there is a important clause that the payment of professional services. As far as the payment for professional services in our country is unheard, and all the teachers will able to earn the money through providing the services to the patients. So initially, to encourage them, we are Association of Community Pharmacists of India is encouraging the community pharmacists, retail pharmacists who are going to collect a prescription from the patient and interpret it in a proper manner. And that documentation has to be given to us. Further, what will happen is the in the developed countries like America, USA, America, and Canada and New Zealand, any country you take, so there is a payment for the services. But in our country, there is no such system is there. So such system, what is the advantage of such system is, if such system comes, the people will move from the pharmacists will or the doctors will move from the patient centric, so from the product centric to patient centric. In our country, the products are emphasized more important, and they have been sold like anything under the promotion schemes of the manufacturer. So this has to be stopped. So fortunately, in the developed countries, they have made this system. In Australia, recently they are paying $18 for prescription analysis by a community pharmacist. So now coming to the other aspect of it. So it is only a right and privilege of registered pharmacist. No other than registered pharmacist can do the interpretation of the prescription. Can I have the next slide, please? So talking of, no. We are going to the previous slide. Next slide. Next slide. Yeah. So this is a thing. And what are the important duties of a registered pharmacist? Important duties of a registered pharmacist is the checking the prescription for duplication of medicine. In our country, we have 1 lakh formulations. Most likely that there will be an interpretation, there will be a duplication of the drugs. So that has to be checked, and dose has to be checked, dose has to be matched. All these are the things other apart from the adverse drug reactions. Means the patient is more important here. We give a patient care more important rather than a product promotion. Please note this point. And then next slide, please. Can I have the next slide, please? Yeah, there is a penalty for that. Punishment also is there. If anybody responsibly does not provide proper services and for his own selfish reason he violates ethics, he will be punished. So that is being mentioned here. So next slide, please. Yeah, next slide, please. Yeah, come to the next slide, please. So all of us we know that all drugs are harmful, irrespective of their safety studies. So we have to be extra care and cautious about how to use the medicines. These medicines are used indiscriminately in our country, and as a result of it, people are going into a lot of health issues. May not be immediate, but again, long-term issues will be there. So all this to counter this, to make it to this thing, the pharmacy community connect program is launched. So pharmaceutical care and pharmacovigilance, these are the two important things. Pharmacovigilance is the counting after the event has happened. This is the prevention of the practice is the prevention before the event happens. Next slide, please. Yeah, next slide, please. Next slide, please. Yeah, this is a person who has started a clinic in 2010 in Pune. She was a student from Kathmandu University. She came and she opened a clinic. And previous slide will show her clinic opening ceremony. And she worked for 1 hour. The modus was she was going to the doctors surrounding her and asking them to tell him about her qualification. Hello.
Sir, you're on mute, sir. I think yes.
So her study was on ADQUIL. She means audit diabetic quality of life. She got a one instrument from UK, and then she evaluated a 120 patients, 60 in the control group, 60 in the standard care. So the standard care and the pharmaceutical care and without pharmaceutical care. So these are the responses. Can I have the next slide, please? Yeah, come out of this. Yeah, come out of this. Next slide. Yeah, move ahead. Yeah, these are the pharmaceutical care cards. Stationaries. Now we have got a software for this to record the patient details. Next slide, please. Can I have the next slide, please? Yeah. Move on. Move on. Yeah. This is the model of FIP WHO, which says that the patient has to come for every 10 days once to meet the patient if he's a chronic disease condition. Otherwise, it's all right. So a patient comes with a prescription, and here the pharmacist will evaluate, interpret everything, and explain the care plan to him, and ask the patient to go away. And then he comes back again to see the pharmacist. Pharmacist again will, with his knowledge, will find out what is the condition of the patient after the 1 week of therapeutic treatment is given. So then he will be able to identify the problems in the prescription in the patient due to whether any drug is more or less. All those things he will check and he will explain it. Can I have a slide, please? So this is a case study. I want someone to read this case study. Please read. No, not this. This is the solution. Yeah. Someone please read this case study.
I'll read it, sir. Mrs. W, a 53-year-old woman, had gastrointestinal acid-related disorders diagnosed by endoscopy. Mrs. W has a history of asthma, hypertension, and duodenal ulcer. Her current drug therapy includes amlodipine 10 mg in the morning, salbutamol inhaler, 2 puffs as required, beclomethasone inhaler, 200 mcg twice daily, and theophylline, 300 mcg twice daily. Mrs. W has recently undergone successful H. pylori eradication therapy, which has been confirmed by carbonuria breath test. Mrs. W smokes 10 cigarettes a day, has a body mass index of 35, and doesn't drink alcohol.
Please go to the next slide. Hello. Please change the slide.
Yes, I'm doing it.
No, not this. Next, very next slide. See now. No. The next slide, which you have skipped already. Solution of this. Hello. Go to the case study and case study explanation. Next slide. Immediately after the case study. Yeah, be on this slide, please. So we have to, after getting the prescription, after interacting with the patients, we have to divide the data into 3 aspects: lifestyle factors, drug factors, and disease factors. How a pharmacist can be useful in this scenario, it is going to interfere, inference will be there. So she is a smoker, and we all know that it contains nicotine, and nicotine is also dilates uh, uh, the sphincter muscle and makes the acid to pump into esophagus and causing a burning episode, a severe burning episode in the esophagus. That's your BOD. Now, you have to offer a patient cleverly that if you smoke less cigarette, the nicotine will be less and the sphincter also will become tight. It will not allow the acid to pump back. So she will experiment herself and find out that it is not coming up, and her episodes uh, of the burning episodes have come down. So now she will realize that whatever you advise, if she follows, she will get a more relief from the pain. And coming to the drug factors, doctors have prescribed amlodipine and also the amlodipine for the BP management and also the theophylline for the management of the asthma. So theophylline and the this thing are theophylline is, we know that it is calcium channel blockers are the and the theophylline also a cousin of caffeine. So going to worsen her condition because the acid is secreted and amlodipine is used. So for the management of this asthma and the hypertension, there are many categories of the drugs. You can suggest that this patient is having a condition called BORD. So may doctors please give alternate drugs for the management of asthma and the BP. The doctor will be very happy and he will change the drugs. And that's how the patient will get a much relief. Coming to the disease factor, usually the asthma in the BORD patients is associated with the acid escaping through the lungs and entering into the esophagus and entering the lungs and causing a acid So regarding the disease factors, the as her URD, the H. pylori infection is cured, is confirmed by urea blood test. So what is that urea blood test? I would like to talk about it. So in the urea blood test, radio labeled urea is fed, and then the carbon dioxide and the ammonia are liberated by an enzyme produced by H. pylori, not by human beings. So if there is no negative report is there in the urea blood test, the radioactivity is not there, then it clears that she is cured from the GORD. So as a result of it, you can do a P-flow test, measure the asthmatic respiratory volumes. If the respiratory volumes are more than that asthma, then you can say that the patient is cured of asthma. Then you can send a message to doctor. This patient has checked, he has no asthma as per her P-flow values. So doctor also asks the patient to make the readings of the P-flow meter, and he also finds out there is no asthma in that patient at that condition at that time. So he will write off all the anti-asthmatic drugs. So this is the way in which you can contribute, because the doctors and pharmacists and nuts should work like a team, and then it helps the people. So that is, I think, thank you very much for your patient hearing. Let us, I'll hand over the mic to Dr. Mahadev Bhatt for further deliberation. Dr. Mahadev Bhatt.
Hello. Hello. Thank you, sir. Thank you very much. Hello.
Dr. Mahadev Bhatt is there?
Yes, sir. Yes, sir. His sir is there.
Yeah. Sir, you can take over from here.
Yes, sir. Thank you, sir. Thank you for your wonderful talk. Before sir proceeds with the session, I would like to introduce Mahadev Bhatt, sir, to all our participants who are there online. Mahadev sir is a retired clinical pharmacist. Went to USA right after his pharmacy graduation from LMCP in 1972. He has done all part of pharmacy over the last 50 years in USA, 18 years in industries like drug industry, cosmetics industry, and nutraceuticals in various positions such as R&D director, plant manager, operation manager. He has 12 years of hospital pharmacy experience as a director. From over 18 years, he used to own 4 community pharmacies with a home health care, injectable preparation, diabetic care, asthma care, osteoporosis center, breast cancer counseling, geriatric pharmacy care. Then he also joined Walgreen retail chain pharmacy in 2003. Is retired in 2015 to 16 from Walgreen pharmacy. So we extend a hearty welcome. Also, we would like you to take over the session. So you're on mute, sir. You can unmute.
Can you hear me?
Yes, sir.
Okay, I am under the name Rina Trivedi. Okay. Good morning, everybody. It's almost afternoon, and there are a lot of good things happening here. And in last 2 days, I have heard a lot of news. And with Dr. Sujitra ma'am, we were at Mysore. Dr. Joshi was there. And pretty soon, you are going to get the first vaccinator pharmacist in India. And his name is Raj Vaidya. So the future is very bright. All of you will be trained after the pilot program is over. So, get ready for that. I read a note from the Ministry of Health that in Uttar Pradesh, they are going to open pharmacy clinic as a pilot project, I think 7 or 10 of them, where a B.Pharm graduate can run the clinic to help to convert the brand name. There are 350,000 medication in India, which I don't know how you all can remember it, It's it's just mind-boggling, But eventually, it will help the community to get the right drug, right name, right dose, right timings. So these are the 2 good news. I think within 2 years, these things will happen. So there is a very bright future. What I'm going to talk about is that there is a process where you can utilize your knowledge. I have graduated in 1972. My syllabus was 8 pages, maybe 7, Look at your syllabus. How large it is, maybe 30, 40 pages. So you all are a lot smarter than me, and you will do a lot better than me. What I'm going to do here now is going to take a couple of clinical studies, which will tell you how to approach. First, I will take a study in the community pharmacy, and then I will come back to hospital pharmacy. Suppose the patients walk inside the community pharmacy and suppose you are offering a free blood pressure measurement. And how can it help you? Or how can it help your consumer? And this is a real life thing which happened to me in 2015 or 16, just a few months before I was going to retire. It was a long weekend. I think Thanksgiving holidays, I was working the weekend shift. We all have to work alternate weekends, anybody in the health field in US. Around 2:30, 2 ladies walked into the pharmacy. One is very upset, other one is a little bit concerned. One person was around 45 years old, Another one was around 14 years old. So it's a mother and daughter. The daughter comes to the pharmacy and he says, "Doctor, help me. I need to measure the blood pressure." I said, "Fine, we'll do it." And she was bit agitated. And I was doing something with the computer, so it took me a minute and she didn't like it. So what I did, I gave her a piece of paper to fill out, because before I touch her, I wanted to be sure that I have her permission. She filled out the form, and what all I had to know was what is her date of birth, what is her phone number, and if possible, she can tell me the name of a doctor. Now, getting these two things, I have a capability of looking into 8,700 stores in the United States or Puerto Rico. And I used to work for Walgreens. That is she our patient or not? Well, since the daughter was a little bit concerned, I took the blood pressure unit and went out and I started measuring her blood pressure. It was 237/92. And most of you are PharmD students. And I did mention the age. That's pretty high, you know. So what would I do? Now, pharmacy is a teamwork. There is a technician, you might call it a diploma pharmacy student. There is a B.Pharm, there is a PharmD. In the United States, we have got only two bachelor in pharmacy colleges. Most of them are PharmDs. And to your surprise, they all come to community pharmacy because there is a lot of money in that. I measured the blood pressure and I was a bit concerned. So I had a technician who was Hispanic because this girl was speaking Spanish. I can understand Spanish, but I cannot speak Spanish very well. So I asked Isha that, can you come and talk to the patient, and find out what is going on. At that point, I knew that there is something waiting for me in the pharmacy. I went to the pharmacy and she was our patient. She was a patient of Walgreens. At some Walgreens she used to go. She used to take the medication, metoprolol tartarate, 1-PO BID, and she was also getting some birth control pills from us over the last 9 months. Her doctor name was Dr. Leong. Well, this helps me. So I knew what I'm dealing with. And then I offered her to drink some coconut pineapple drink, 16 ounce. I asked Isha that go and buy a drink, I'll pay for it. But I want this girl to relax because she had red flushes over the face, So she liked it. Apparently, I think she preferred the, flavor of it. And when you put pineapple and coconut together, it's a little bit sweeter side, And when Isha comes inside, she tells me that patient, because of the long weekend, all the relatives had come, uncle, aunt, auntie, cousin, sister, everybody. And they had some kind of a miscommunication. Generally, it happens when family get together, it's called cousin rivalry, I bought this and I bought this and I got this gold and, blah, blah, blah. So she had some arguments, so she was disturbed. But she told me one thing very interesting, that because she was busy cooking, and entertaining the guests, she has not taken 3 doses of her blood pressure medication. Well, that's all I needed to hear. So I gave her around 10 minutes, and then I asked her, would you like to void the bladder? Now, what happens that I had suspected that there could be a volume problem, and she was flushing, so I thought that some of the medication might have gone into the periphery, not medication, the blood. So she was, slightly agitated. So the body was trying to lower the blood pressure by itself. Body does have that capacity, After 10 minutes, she said that, she will not mind going to the washroom, At that point, I asked her, I said, why don't you deep breath through one nostril and take it out through the opposite nostril? So, I showed her how to do it. Being an Indian, we always try to rely on yoga. So she was breathing in through the left side, then she will close the left nostril and she will breathe out through the right nostril. And I asked her to do only 10 times. By that time, I noticed that the redness on the cheek was slightly lowering down. She went to the restroom, she violated the bladder, she came back, and she was smiling. When she came, she was about to kill me, because blood pressure was so high. And so now I thought this is the right time to remeasure the blood pressure. You all will be surprised. It came down to 153/82. A serious situation was avoided because I had already asked Isha to alert the store manager that I have got a difficult case and I might need a, what do you call it? We call it paramedics. Here you call it ambulance. So can transport the patient to the emergency room. And she was happy, I was happy. And so at that point, I had a prescription on file. This is very important. Listen, guys, there was a legal prescription on file. Patient had a medication at home. She had missed 3 doses, but there was no refill. So being a registered pharmacist, you do have certain powers that you can take some risk. So I asked a technician, that why don't we give her 1 tablet of metoprolol tartrate and send her home. So I gave her the medication. I say that this is around 2:30, 3 o'clock, around, it was she came at 2:33, so it was around 3:30, I finished that. And I said, I'm giving you 1 now, but tonight, you should take the 2nd dose. Now remember, it's a BID, okay? So how would you divide the dose and how soon you can give the next dose? Suppose it is Q12 hours, you divide by 2, that is 6 hours. So anywhere between 4 to 6 hours, she can take the 2nd dose, okay? That's the normal thumb of rule. She won't be worried. Now my work was not over at this point. I went inside the pharmacy. I wrote an email to Dr. Leong, and I said, such and such patient with a such and such date of birth and such timings, and you always write the timings in military hours, 1503 or 1524, so you don't have to say AM, PM. And I explained the incidents. I wrote down very briefly what I had done and what was my observation and what was my outcome. I did not tell the patient that doctors should have changed the medication earlier because the way her house and things are there, and she has got 2 kids and she's a pretty busy woman, so doctor should have given something else. So I recommended to doctor that at this point, I would like to inform you that this is a great candidate to change to metoprolol succinate 100 milligram, 1 tablet a day around 10 o'clock, in the morning, after she finishes her breakfast. Now the advantage is that 100 milligram is going to go in her body around 4 milligram per hour, so she is not going to have the drowsy effect. And when we had asked her why she did not take the medication, she says, I was busy and the relatives were there. So generally when I take that medication at 8 o'clock, I feel a little bit tired, So I could imagine why it was. And then I sent the email to the doctor. So 3 things happens there. It was simply a blood pressure thing because somebody said that they feel high. Then the second thing, what we find out, that there was a problem of non-adherence. Patient was not able to take the medication in time, and she was a little bit lethargic because the timings were said wrongly. Now, we have to keep the confidence of the doctor in the patient. We are part of a link. So never, ever, never, ever, I'm going to say one more time, never, ever tell patient that their doctor is wrong. Because you don't want to upset the crocodile if you want to live in a water. Okay, because if they don't write prescriptions, we don't make money, But you have to tell them smartly, and you have to give them a reason that there is a product like this available on the market, so they can appreciate what you are doing. Well, on Monday morning, it was a day off for me because I worked the weekend. That girl comes with a big, nice cake to the pharmacy, and they said, this is for the Indian guy, So technicians called me at home, and I said, well, I cannot enjoy the cake now. I'm diabetic, and why don't we put the cake in the lunchroom and call all the girls from the front, and they all can enjoy the cake. But funny thing is this, when I came back to work on Tuesday, no, I came back to work on Wednesday, and each pharmacy has got a drive-through window, like you go and buy your hamburger, it's kind of a practice. They said Dr. Leong is waiting in the drive-through, and they would like to talk to their uncle. Now, generally, I'm known in my pharmacy as uncle because of my age, and there is a teamwork. I have Ph.D. students, I am the manager, I've got technicians, I've got cashiers, I've got around 6 or 8 people working, for me. And because of the teamwork and because of the relationship I had with my technicians and cashiers, they helped me to achieve these things so I can stay relaxed. That was very important. And the teamwork is very important. So please do not, even think that B.Pharm or diploma or Ph.D, all of us are registered pharmacists. That means that in all the countries in the world, they have given you a chance to touch the medication. Okay, everybody doesn't get that chance. So, actually, I, jokingly, I call myself, I'm a legal drug pusher, and sometimes we have a lot of problems in America about the OxyContin and things. You guys might have heard about it. There's a morphine things, and people abuse it. And sometimes I get drug suppliers, to come and pick up the medication. And when I want to refuse something, I do tell them that you and I are both same. The guy will come with a gold chain and things, and there are 2 people following him and glasses and all. And I need to pacify them. And I say that, well, you do one thing, you give it, I also give it. But only difference is that I do it legally, and I need to honor it. And so doctor came to thank me that I helped him to save his patient. And he said that I have already called the corporate, and they said that, you like to be called by the name, Dev uncle. And I really sincerely thank you. And anytime you can change whatever you want for all of my patients. I got a blanket, okay. Can you believe that? Just because you did something. But when you do something, don't do it with the authority. Do it with the empathy. Why would somebody come to you, to the pharmacy, unless, they need something? They don't come to say, hi, hello, how are you? They were upset. The girl, 14-year-old girl, was worried about her mother. We have to put them at ease. You have to say something nice. Yes, I'll be right there. I took few minutes and she didn't like it. I didn't get upset at her. I was the highest paid guy in the whole building. It was a 60,000 square feet store. We even get paid more than the store manager. But at that point, you have to look at the patient, find out what they want, and remember, you go stepwise. And then you find out the remedy. And when you tell doctor, you should have an answer what you are suggesting, and why you are suggesting. Now, I think Dr. Suchitra knows that I was in Mysore and then I went to Hyderabad. On my way back, there was a guy who was sitting next to me on the plane. He was touching his ankles and, so I looked at it. I didn't know him. And I saw a lot of swelling there. So, and he took his socks out and I could feel it, And I asked him what is going on? Are you under the doctor's care? He says, yeah, I'm under the doctor's care. And lately my feet are getting swollen. I said, what did he give you? So he says, who are you? I said, no, I'm just traveling and I talk to the different students and young India is very smart and I like to talk to them. And I said, he says, what do you talk about? I said, I talk about pharmacy, but I'm not a teacher. I used to practice community pharmacy and hospital pharmacy. So he opened up and he says he was taking amlodipine 10 milligram twice a day. Wow, answer came right there. I said, did you started with that? He says, no, it was 5 milligram, then it was double up and then it was double up again. And since I did this thing, I'm having this swelling problem. I said, okay. So I wrote something down. I said, show this to your doctor, And, today, how many tablets? I took one. I said, tomorrow just take 5 milligram, cut it in half, and maybe it's okay. The funny thing is that I landed at the airport. I looked for my Ole, to come to where I'm staying. And he left. Then next day, where I'm staying, his younger brother is what do you call it? He's not a chief justice, but he's a justice of the Gujarat High Court. So I was just going to go and say hi to him. At that point, this guy was sitting there and he looked at me and he says, hey, you're the guy whom I met in the plane. And you are damn right that I missed the dose. And this morning I took 5 milligram and I feel great, And then he asked me, how did I do that? I said, no, it's not a miracle. Anybody would have done it, And these are the things. So what does this tell you? How does the doctors are practicing? I didn't want to criticize him, but I said, it would help you a little bit if you take magnesium chloride, because this is calcium channel blockers. And, there is a L channel and an N channel and a P channel. I didn't tell him those things, but they are competing against each other. And whenever you take those things, you do have depletion of magnesium in the body, and the magnesium causes the contractibility of the muscles. Now, there are so many nodules in the body, and they try to push the blood further. The good blood comes from the left side, goes there from the right to upper one. And when you've got a swelling in the ankle on the right side, they say the CHF, and there are a lot of other things, So you have to identify the things, okay? And then you have to suggest. You just cannot go and advise. You have to know a little bit more. And then you can recommend. And then while we were sitting there and having a tea, the doctor called, because, justices of the, High Court, they've got a lot of pulling power. And he says, he talked to me and I explained to him and I said, if you take a look at it, this will help. And I think magnesium is going to do the trick, And he was also taking simvastatin, that patient. Okay, that's what the doctor told me, because I didn't want to overstep my boundary, And you know that simvastatin is the most overprescribed medication in the world. There are 4 kinds of statin, okay? And if a person who is 60 years old or 70 years old, it's a different story. But when you give that medication to a 24-year-old, it's a different situation. You have to treat them separately. you know, and you have to look at certain things. Now, this judge had two things going for him. He had a pain in the leg also, and he had swollen ankles. So doctor says that he has been complaining about the leg cramps. Then I try to explain to him as much as I can. And you all should know in the second B.Pharm, you'll study the biochemistry. In my days, I used to do that. I don't know what it is right now. And at that point, you do learn that how the energy is produced. Remember ADP, ATP conversion, mitochondria, things like that. And I had something, vaguely in my memory. And there is a product called coenzyme Q10. And simvastatin or all the statins, they will inhibits the conversion into ATP. There is only 4 minutes time is left, from this one to that one. And because of that, lack of conversion, the muscle mass are kind of throbbing and you get a pain. The person who is known in America as the father of coenzyme Q10, his name is Dr. Raj Chopra, authority on mitochondria library, when he talks, people in US, they line up, like Dr. Whitaker and Dr. Bald and, you name it, all the big shots in the nutrition. And this guy is a pharmacist. He became pharmacist in 1965. He is from my college, LM College of Pharmacy. And he was directly, in those days, there was no such thing as a student chapter of the Indian Pharmacy Association, but his principal created that chapter and he was asked to go to London to study further. And from there directly, he was asked by Columbia University to come and finish his PhD. But he was always interested in biochemistry and he was a very smart student. Now, what I like to impress on you that when you study, try to figure it out that what nutraceuticals can help you. If we don't sell drugs, we don't get paid. And Dr. Anantha says sometime that drugs, you should take it, not sometime, all the time he says, that you should take drug under the supervision and you should take them when you need them. Okay, so imagine what is your responsibility. But are you using it all the way? You've got a chance. I don't get paid for a lot of time when I do the talking or when I go and talk, but I live on a block where there are 15 homes. It's a very exclusive neighborhood. And anybody who takes any new medication, they come to my house, they knock the door and they can ask me whatever you want. I did quite a few things in community pharmacy where you get certified for diabetes and geriatric medication and sport medication and cardiac medication, because I love studying. So you do have a chance. So this is going to tell you that how much you can help people, Let me ask you one thing. I think I talked to Dr. Suchitra that does all of you have a medication profile of your immediate relatives? Do you know what your mom is taking? Do you know what your parents are taking? So your dad or your uncle or aunt, or maybe do you know what your girlfriend is taking or your boyfriend is taking? By the time you come to the 3rd and 4th year, you should know that because we get interns, PharmD interns, right up from the 1st year. So when we get an intern in the pharmacy, we know what we are going to teach them. We know what we are going to tell them in 2nd year. We know what we are going to teach them in 3rd year. By the time they are in final year, they get a special training from our supervisors to do the management of it. Now, this is not going to happen here right away, but those days are coming. And work as a team. And my suggestion is that, because I was a director of a hospital pharmacy for 12 years, is that you should know when the patient is admitted. You should write it down. Because most of the pharmacists, they feel that they are the master of the antibiotic, that's, and the antibiotics reviews are the domain of infectious disease. The reason you should know what time they are admitted and what antibiotics they have started is not for their benefit, because when the patient comes on the floor, they will order CNS, culture and sensitivity. Now, did you already give a one shot and then you are doing the CNS? Nothing is going to come. 48 hours. Go and look at the petri dish. Oh, they are getting better. And then what happens? They stop it, and then again the fever comes. So rule of thumb is that if you are reviewing the antibiotic thing, then you have to know what happened when the patient entered the hospital. Second is that how the medication are given in the hospital. People don't come to a hospital to take medication by mouth, because we have to get patients out of the hospital in America within 4 or 5 days. Because if anybody stays more than 5 days, we lose money. Because the most of the government pays the money, or the insurance will pay by DRG. What is the diagnosis? And how many days patient can stay under that diagnosis? And we will have to argue with another clinical pharmacist, because insurance company does have a clinical pharmacist. Other thing is that how can you help? Because see, in hospital, you have got nurses, you have got LVN, you have got doctors, you have got lab technician, you have got respiratory therapists, everybody. You are just a 1/6 part of it. You are sure going to help to avoid any drug interaction or get patient better, but you got them better to go home. What is the criteria to send patient home? Patient should eat, patient should have a bowel movement, patient should go and empty the bladder, and patient should walk for 5 minutes. So they will have a physical therapist, and they will take them out. And if you do these 4 things, you send the patient home. But that's where your responsibility comes. When this patient is going home, how do you convert his IV antibiotics into the oral antibiotics? And this is your chance to talk to the patient, because you know that these people are going home. Otherwise, during the therapy, you can't do, because nurses are taking care of it. So you have to grab your opportunity to find out what is the conversion of IV antibiotics to the oral antibiotics and where they are going to pick it up. Because in America, hospital does not dispense any outside prescription. They don't have a license for that. Some hospital will have to take a separate license to dispense medication for patient to go home. Now, once you establish this thing, what will happen is that you are going to help the patient to get acclimatized into the community. And that's where the community pharmacy comes into effect. So find out what are, if you are working in a hospital, find out which are the medical shop around, and can you send them the prescription and get 3 days medication? So patient can go home, otherwise patient is going to miss the whole dose, and they might end up coming to you after 2 or 3 days. The responsibility of a pharmacist is to avoid unnecessary admission into the emergency room. And this is everywhere in the world. And that's where you come in, and that's the reason you have to find out that they take the right drug. Okay? So much for the hospital. Now there is a way you can do it. there is a very simple thing. You call it a brown bag review. In your home or anywhere else, say in your home, okay? Put all the medication in a brown bag, put it on the table, and find out what the patients are taking. So you got a data. You need a data to do anything. There are some oral medication, and I bet you there are more than a couple of antacids. You know, there will be protein pump inhibitors and things like that. And then you find out what time they are making the medication, taking the medication. Like I said about the metoprolol tartrate, twice a day, or some doctor will write 8 a.m. and 4 p.m. For that medication, that is not the right time. The person has to do some cooking, person has to go to shop, he cannot be lethargic when he goes through his work. And you have to adjust it and make sure that you take advantage of the side effect so the patient feels better. Metoprolol tartrate is going to give drowsiness, you know. But yeah, why can't they take one when they're going to sleep? Aspirin, why can't they take when they're going to sleep? Simvastatin, they can take at night, you know, so they will complain less. Look at their diuretics. You know, I had a patient in Chennai, you know, and he was taking 80 milligram of Lasix, you know, furosemide. And he didn't have 80 milligrams, he was taking 40 twice a day, because very smart guy, very rich guy, you know. And so his wife tells me that, you know, all night long he bothers me, he keeps going to bathroom. Now this guy doesn't want to ask his doctor, but he says, why should I go and buy 80 milligram tablet and take in the morning, but I have got 40, so let me use it up. Now, the same thing you can do to review the medication and tell them what are the better timing to take the medication. And now, how would you like to make some money without putting any money into your inventory? If doctor can visit patient's home, why can't pharmacist visit? You know, twice a month, go and check it out, the blood pressure, blood sugar, look at the medications, tell them what time to take. Find out when they are going to make a visit to the doctors, and you write your notes and you give that piece of paper, so when patient goes, he can take it with them. And very easily, people will pay 1,000 rupees a month for this kind of services, but you have to be more innovative. Think about it. I think day before yesterday, ANANTHA sent me things that practicing teacher, pharmacy teachers for a review of this medication. And once you are a registered pharmacist, you can do a lot of things. You know, you don't even have to have a shop. You know, there are a lot of apps available. You know, I think I sent one app to Dr. Suchitra, EY. You know, you just have to put the phone number, gather the medication, write the name. You can put all the lab tests in there. And the most important is that via WhatsApp in your own language, you can send them the note when to take the medication. Anybody would like it. You know, suppose your grandmother or mother, they don't understand English, you know, but you can send, you know, Amma, you know, it's time to take your pink tablet. In this app, he has got all the colors of the medication, brand and generic, things like that, and make it easy for them. So they will count that you are going to go there, you're going to tell them, you know, and WhatsApp is free. You know, you can set it up automatically by app, you know, and anybody would like to have some extra help. Like I'm a diabetic, right? So I'm with a Kaiser Foundation in America. Kaiser is on the West Coast and Geisinger is in the East Coast. So one day, all of a sudden I get a message that would you like some help to do some exercise? So what they did, Kaiser, they give me a choice. from the following, tell us what is your birthday. There were 3 options. So I said 1, 2, or 3. So what they did, they identified me that I'm nobody else. Then the next question is that is your email address, out of 3, which one? So I did. So now they say the third question was, how many times a week you would like us to contact? So I said once a week, because I thought I'm too smart, I'm a pharmacist. Why would I need the help? So the fourth question was that, how much do you walk? So I said 15 minutes, I said, what is this automatic app is going to do? You know what I answer get? Sir, we know you are a pharmacist. You are a doctor. Minimum you should walk is 30 minutes a day. You are walking very little. The way they had asked me, not per day, they had asked me per week. So I put, 1 hour or half an hour, something like that. At that point, I realized that how much I liked because somebody talked to me. I increased my walking, and I had some swelling in my ankle because my children are doctors. So I take a lot of medication because since I'm diabetic, they asked me that to protect my kidney, I should take 2.5 milligram of lisinopril. Since I had a kidney stone one time, so I should take 12.5 milligram of hydrochlorothiazide. So I do not form more stones. It helps to dissolve it. And since the third thing was they were giving me 10 milligram of pravastatin every day. I never had a cholesterol in the higher side. So eventually it caught up with me and I was getting some leg pain. So what do? I called my preceptor, Dr. Rishi Raman. Now this guy is in the family hierarchy of Dr. C.V. Raman. He graduated from Bangalore Pharmacy College. And after he came to America, he did his Pharm.D again, and he went to Carrington, and I became a pharmacist very late, because I was in the industry, as my profile said, and then I wanted to change the line. And he says, let's get your lab test and all. I said, well, let's take off last 6 years, because I'm with Kaiser. So we look like, I never had a high cholesterol. I never had this thing. Only thing I was taking pravastatin because in those days, they thought that pravastatin will help to increase the good cholesterol. So my cholesterol, good cholesterol had come up to 40. In the beginning, it was only 27 or something like that. So my preceptor, tells me, he says, Dave, it's time to either discontinue, but we are not going to stop it. Let's start taking that medication every other day and write an email to your doctor that these are the 3 things, these are the results. So I started taking pravastatin every other day, and now I'm taking every 3rd day, to keep my children happy, because when you got children doctor, you got other problems, and it's another thing. So
very, very elaborate session, Dr. Madhav.
Okay, I'm almost done. Okay. So you have got an excellent line. If I'm going to be born again, I want to be a pharmacist. Make use of it and try to help your family, your patients, and be proud of it. Okay, thank you so much. I'm done here. Any questions you can ask. Otherwise, send me a WhatsApp. Okay. Somebody want to read the question? There are some hands up.
Yes, any questions, you can put it in the chat box. So from our students, there will be a question, probably, I think they are setting up a mic to ask the questions.
Okay, no problem. but be kind to your patients. Give them a smile when they come. Tell them something nice. Even that smile will help them to get better. You have an opportunity to serve the community with empathy. Collect some blessings. And they are your patient too, not only doctors.
Thank you, sir. Thank you so much for such a nice session. You have highlighted a lot of points on how you need to be, how a community pharmacist or how a pharmacist need to be communicated to the patients. That's so wonderful, sir. We would like to take up the question, sir. Is that okay? Shall we go ahead?
Yeah, sure. Go for it.
Yes, sir. So there's one question that has been asked. Like a lot of times, patients will not be so comfortable to share information to the pharmacist when compared with the doctor. So what is that? What is your take on that? How we could make them very comfortable?
Well, number one is that ask them to gather all the medication and you take a look at it and tell them that what time they are taking. Never discourage the patient. You have to make them feel comfortable, and it's like a boyfriend-girlfriend relationship. If you like somebody, you are going to go 7 times, and once you have that, you find a comfortable zone, then you do that. Talk to them in their language. It's not that you are talking to them, it is you are talking with them. You are part of them. Give them the example that, yeah, I have another patient who did things like this, and I was able to make them more comfortable. And also give them the assurance that anything new you are going to try, you will inform their doctor. You take them in, like the lady I did, I did inform the doctor and doctor came and thanked me. So you are in between and you have to find out how do you walk that line. And I think generally girls can do it better than boys. And offer them some services. Anybody would like if you take their blood pressure, doctors, they might go to the doctor once in 3 months and go to the pharmacy more often, in hospital admission, patient might go 1 in 6 months in the hospital. Doctors once in 3 months. They might come to pharmacy for 3 or 4 times. And anybody would like if you remind them that it's time to renew your medication. What I have noticed is that patient comes, they give them one medication, then they don't even care that they have got a refill or not. Be cooperative with them. Okay? You will win them. It's a psychology.
Sure, sir. Thank you. Thank you, sir. So we have questions from the audience as well. I mean, from the participants.
See, the way I started the conversation on a plane, I didn't know that. I didn't know he was a High Court judge. It was out of the blue. I saw some swelling. Oh, yeah. So, you must be taking medication. Hi, how are you? And always identify yourself, who you are, and then you go with them.
Okay, sir. So we have question. Shobha Rani, ma'am, you would like to? Ma'am, you can unmute yourself, unmute the mic.
Okay. Can you hear me, sir?
Yes, I can.
So the sessions were very informative. And you gave a lot of examples also. And now I want to know how to take it forward in Bangalore city. Like I had discussed with Dr. Anantha sir. So can you just give us some guidelines on how we can take it forward in Bangalore?
Anantha, it's all in your court.
Is it echoing? Because from our college, we are interested to take it up.
Well, Anantha, are you going to respond to her?
Yeah. I'll elaborate it.
Okay.
So now, as the seminar is over, now we
Yeah.
can start the actual work. So what we should do is we should divide
What should we do
the
next?
faculty. A small team is to be formed, and then collect a prescription, or you can use a medical matter. So you
Can you repeat? We could not hear properly.
can collect the prescriptions and then on your WhatsApp group. Then Madhav and myself or some of the Shivarani madam, you can also resolve because you are very much knowledgeable about the practice.
Yeah.
So you can also resolve the help people, and then it is the national movement. I told you. So we have to start it somewhere. Now we
Yeah.
are starting it here. So it should, and it should see, to promote this thing. We have made another foundation for your
Yeah.
information. National Foundation, ACPA National Foundation for Pharmacy Practice. So we are asking Madhavat and others to help us to arrange funds. So the funds will be there, and we are going to offer each teacher, each registered pharmacist, 5 opportunities. In that we are going to pay them 130 rupees. So if we associated with 5 patients, it will be around 700 rupees, 620 rupees will come. So that money can be taken, and in that process, the initially जो है ना, जो what you call it as uh, hesitation of talking to a patient, that should be overcome, and then you can start your own practice.
Yeah.
Hesitation is when you want to speak because it's all new to us. So we have a lot of hesitation to speak to patients. So whenever we come across when some money is there, usually the registered pharmacist will take care of you. So that's how the gradually you will start thinking about the patient rather than about the drugs and treatment and other things. So your primary focus will slowly shift to the patient care. So gradually, so it is the 1 or 2 visits. So we will go and if he is in your apartment side, if the patients are remaining thereby, then you can talk. But basic equipment you have to invest. Our college can also spare if they have got extra equipment like BP apparatus and the blood sugar measurement. Usually, your patients do have in their own home. So only thing is you have to motivate them to buy these things because
Yeah.
they have it means they can they are
Yeah. And students also can get the prescriptions. They are not the registered pharmacists though, but still we can encourage the PharmD students to get the prescriptions of their parents and their family members.
Yeah, the data collection is very important, and better to charity begins at home. Prescription you can get it, but find out that why they are taking it, because once you get the prescription, you have to analyze them, why this
Yes.
medication is given.
Yes.
Now, if we go stepwise, that if they use the app, you have to put the phone number, and then you can write their medication, there. Then you also can write down what are the over-the-counter medications they are taking.
Yes.
And some of the over-the-counter medications, they interfere with that. You can also write down there that what diet they are on. You know, do they
Okay.
need protein or they don't need protein? Or how can you do the, if you remember, I talked about their carbohydrate to fiber ratio, and
Yes,
you
yes.
have got a nutraceuticals 50 hours. And what nutraceuticals you can do it. Whenever you got a calcium channel blockers or certain thing, they all compete with each other. You know, like enteric-coated aspirin. You know, why you do take that? You know, why not? It goes into the stomach, then it does it. And then try to recommend some nutraceuticals with that. So that
Okay.
the students can do. But
Hmm.
you know, the second stage is that they will come with a problem.
Yeah.
And so instead of you going to the classroom and teaching them, they are going to come to you and you will have an opportunity
Yes.
to show them. And, you know, somewhere you have to start. And, you know, like, you know Raj, right? So
Yes.
what he has done it. So all of them, the vaccination program is going to come within 2 years, you know.
Yes.
So you have to fire them up, and it starts from a home. And
Yes.
anybody at the house, if they got benefited, you know,
Yes.
if they got benefited, they are going to recommend you another person that, hey, my daughter or
Right.
my son, he can do that. When you go out of your house, any boys and girls, they should know you are studying pharmacy. In my neighborhood, they know that Uncle Dev is a pharmacist, you know, and you should be very proud. You can do so many things, you know, wonders. Let's change India, you know, and you people are a lot smarter, you know. I was looking at the syllabus, but say, don't, you know, you can rely on it, Google, but Google is the information, you
Right.
know, and your teachers are the experience and the knowledge. So you have to decide what you want to do. I gave only one example, I think. When somebody says measure blood pressure, what you do, how to measure blood pressure in YouTube, right? No, I don't do it that way. I'm a pharmacist. I will say blood pressure sound. So you have to think what you are looking for, and then you will explore. And you
Right.
know,
So what about the app you were talking about?
I think I sent it to you, and it's called
Yeah.
eWhite. And
We will share it. You will speed up.
go ahead, doctor.
So we'll go ahead with this.
Yeah.
We're very interested, and we have pharmacy program also, and we have faculties also who are registered pharmacists. So once we get the app, we'll start filling the details and we will start reviewing the prescription.
This is a great opportunity, you know, and you know,
Yes,
like
indeed.
the things are going to happen, and the Uttar Pradesh is doing it like a pharmacy. You can use the name clinic, isn't it great? You know,
Yes,
and each one has to develop their own technique, you know, and the teachers will have to get a little bit involved in that, you know.
right. Okay, thank you, sirs, both of you.
Thank you.
We'll initiate it and then we'll be in touch with you. Thank you very much.
Definitely. Thank you for giving me the opportunity to talk to you. Guys, go and get it. Make a lot of money, 1 lakh per month. You are capable of doing it. Thank you so much.
Thank you, sir. Thank you so much. We thank Mr. Mahadev Bhatt, sir, also NAIK NAGAPPA, sir, also Shobha Rani ma'am, our director, as well as our principal in charge, Dr. Suchitra ma'am. We thank our chairman, Dr. B.A. Vishwanath, sir, for providing this platform to conduct such a great talk on Community Connect Pharmaceutical Care Everywhere. We thank all the patient participants as well. And we thank all other faculties who have also joined here. Thank you, sir. Thank you very much.
Namaskaram. Thank you so much, Suchitra ma'am. Thank you.
Thank you, sir. I'll end it.